Okay, hi. So today I'm going to be doing the IVPB medication administration. So currently I'm in the medication room and I'm going to first be making sure I have the right patient. Mrs. Durbin, date of birth is January 17, 1930. I'm going to be looking at her MAR and her EHR. So first thing I'm going to be doing is I'm going to be looking at her past medical history as well as her laboratory results. I'm also going to be checking for her allergies. I see that she has no known drug allergies, but she is allergic to strawberries and bees. While looking at the MAR, I also see that she has an order from the physician, which is vancomycin 500 milligrams, IV piggyback, 100 cc's, normal saline over 1 hour, Q 24 hours. When I see the order, I notice that it's the right patient, the right medication, the right dose, the right route, as well as the right time. So the order is perfectly fine. So now that I have that done, I will be taking out the medications. So when I take out the medications, I have I pull it out, my vancomycin, as well as my normal saline. When I pull out the medications, the first thing I do is I assess the medications and make sure that it is the right medication. I make sure I assess the medication with the MAR 3 times. Scanning the barcode does not count as one of the 3. Now for the medications, I'm going to be, I make sure that it is not expired. I look at this one, the vancomycin is not expired. I assess the normal saline is not expired. Perfect. So now that I have this, I'm going to look at I'm going to be doing some medication calculations. So I see that the doctor ordered 500 milligrams of the vancomycin, and also when I'm reading the vancomycin bottle, I see that the amount to dilute that needs to be added is 5.6 milliliters. So in total of the reconstituted solution, it will be 6 milliliters. Okay, great. So now that I have the medications, I have the calculations. I can take out my syringe. I have my syringe out, and the first thing I'm going to be doing is I'm going to be uncapping my normal saline, as well as I'm going to first take out the normal saline cap, and I'm going to wipe it down with alcohol pad. I'll be wiping it down for 10 to 15 seconds. Okay, and I'm going to leave it there, and now I'm going to uncap my vancomycin, and I'm going to pull out my alcohol pad and wipe that down as well for 10 to 15 seconds. Okay. Now that I have done that, I leave that there, and I'm going to be taking out the medication. I'm going to take out my syringe. First thing I'm going to be doing is taking out in air 5.6 milliliters. Okay, perfect. And I'm going to be inserting this into first the normal saline. Okay, I insert it first with the air, and now I can take out the 5.6 milliliters. So I'll make sure that there's no air bubbles. Okay. Perfect. Now that I have that, I'm going to put it back in safely into the cap. And I'm going to take out my vancomycin, which is perfectly clean. And I'm going to be inserting the 5.6 milliliters into the vancomycin. Okay, and I'll be doing it at a rate of 1 milliliter per second. Okay, once I've done that, I recap it. Okay, once it's recapped, I put it in this sharp container hazard. And I take the medication that I have and I mix it. I mix it to make sure that it is diluted. I make sure that there's no particles remaining of the powder. Okay, I can swirl it a little bit. Now that that's perfect, the medication is perfectly in there of the vancomycin. Now once I do that, I have my IV piggy bag. I have my IV bag. I take it out. I make sure it is right, the normal saline. I make sure there's no issues with the bag. Okay. Now I see that there's no issues with the bag. I'm gonna check the expiration date. Expiration date is perfectly fine, no issues. Perfect. Now the next thing I'm going to be doing is I'm going to be inserting the vancomycin into the IV bag. So I'll be taking out my needle. Okay. So before I take out the needle, I'm going to be first actually taking out the cap for the IV bag. And I'm going to be cleaning it with the alcohol pad. For 10 to 15 seconds. Okay, now that it is clean, I take out the IV, I take out my syringe, and I pull out the vancomycin, to be 6 milliliters. Perfect. Now that I have the 6 milliliters, I will be inserting it into the IV bag. Okay. Once it's in, I will press into the. Perfect. Now that it's in, I cap it up and I put this needle into the hazard bin, the sharp object hazard. Now once I have that, I'm going to be taking my medication label. I'm going to be writing down the medication. I'll be writing down the patient, the drug, the time, and the dose so that the next nurse can know what's going on. I'm going to be taking out the sticker and I'm going to be putting on the back of the IV bag to make sure that you're able to read still the front. Okay, once I've added the sticker, perfect. Now that it's perfectly in, it's mixed. So now we have our IV bag and we're ready to go to the room. Before we go to the room, I just want to say as well the 10 patients' rights, which are right patient, right medication, right dose, right time, as well as the right route. Okay. In addition to that, the patient has the right to education, assessment, documentation, evaluation, and the right to refuse. Now that we have the medication all ready to go, I'm going to be going to the patient's room. Once now I have entered the patient's room, this is the patient right here. This is the normal IV bag right here. Okay, I walk into the patient's room. First thing I do is I introduce myself and do proper hand hygiene. Okay, now that I've done proper hand hygiene, I do 2 patient identification indicators. But before that, I just wanted to say one thing. While I was in the medication room, I scanned the IV bag to make sure that it is the right medication and the medication is documented onto the MRI. That's just one thing I wanted to point out while I was in the medication room. Now that I'm back in the room, I introduced myself, I did proper hand hygiene, I introduced who I was, I did 2 patient identification indicators, which is the name and date of birth. I have the right patient. Now I assess, the first thing I do is I tell the patient what procedure we're doing, I tell it the purpose of the medication, I tell the patient the purpose of the medication, the action of it, as well as the side effects. Now that I've done that, I'll assess the current IV line. I make sure there's no issues, there's no redness, no swelling around the injection site. I also check the saline lock. I make sure that it is adequate and locked. If there's any issues with the saline lock, I will flush it out. I will wipe it down with alcohol, let it dry, and I'll insert the new saline. Now once I've done that, okay, since I'm saying that everything is perfectly fine and clear, it's time that I can insert the port. So now that I'm inserting the port, I uncap it. Once I uncap, I insert into the IV bag. Once it is inserted, okay, now that it is inserted, the first thing I want to do is I want to prime it. So I make sure that it is, first I unlock it, I make sure that it is primed by squeezing the bottom bottle. I make sure that it's halfway full. Once I see that it's halfway full, I unlock it. I make sure that it completely comes down. Okay, the rate, there's no issues. And now I lock it up. I insert it higher than the regular IV bag, which is right here, so I put it higher. And I connect this tube port into the normal, into the upper Y port of the normal IV line. Okay, now that I insert into the tube, I check the infiltration rate. I check the rate, which is 100 milliliters per hour. Now that I have the rate in, I also I make sure I let the patient know that I'm going to be putting this. I assess the patient. I let the patient know that to let me know if there's any concerns, any issues. I assess the IV line. Everything looks perfectly fine. No abnormal findings. Patient showing no issues. I show her collar bell, so if she has any issues, she can let me know. And now that I've done that, I let the patient know that I will be transferring this information, the medication, and what I've done to the EHR as well as to the in and output. Now that I've done that, I clean up, I do proper hand hygiene, and I leave the room, and that's IV piggyback.